The LED, you will receive a large red and a large blue LED light. With the red, it's all about regeneration, stimulating the ATP in your mitochondria, in your cells. So it's all about multiplying, it's division, mitosis. So this is very important when you're thinking about either mature or aging skin, or sun-damaged skin, or even oily and troubled skin. So this gives you the primary color to stimulate that sensation of what the cells must possess in order to create that mitosis. The blue LED light, the red is for regeneration, the blue LED light is for oily and troubled skins. This can be more of a target area, again, that you want to at least have the red LED light on the skin for 12, possibly 15 minutes. And when you use the red LED light, this will be after your exfoliation treatments, after your extractions, those extractions of course are optional, but after your exfoliation treatment, you want to start with your toner to make sure that everything and every residue is completely removed from your exfoliation. And then with a clean skin, you may start with your red LED light. Your red LED light is on the area for 90 seconds per area, and you can overlap at least 30 to 50%. You want to influence that stimulation within those cells. So with the red, this is your primary color that must be on the skin for minimum 12 minutes. With your blue LED light, this is for oily and troubled skins. Again, after you have completed your red LED light, then you can move to your blue LED light. You can use this directly on grade 1 through grade 4 acne. So it can be from non-inflamed to inflamed acne or oily and troubled skin conditions. So with the blue LED light, it is on the area, again, like the red LED light for 90 seconds. And then you need to overlap each area 30 to 50%. And you can do it in a localized area wherever there is more areas of concern of troubled skin. With the LED light, you will have 2 portholes, and remember that you can use these lights simultaneously together so that you can have a more of a thorough and quicker treatment, so that you know that if you're working with an acneic skin, you can use red and then follow with blue. It gives you more of a good working flow to complete the process.